Record.
Okay, I'll mute Alan. All right. Hi, I'm Brad Power, and this is the Cancer Patient Lab, and I'll do the standard introductions, housekeeping. First, our disclaimers are that this is for informational purposes only. This is not medical advice. Our goal is to give people information that they can take to their medical team. And the second is this is all public, so everything you say will be published and posted. And I like to call it the Miranda rights. Everything you say can and will be used against you. So just be aware. And so if you want to remain anonymous, don't speak. And if you don't want to have your video image, you can not turn on your camera and change the name on the cover. You can be anonymous if you want. And then finally, Cancer Patient Lab is a patient-led learning community. And we depend on what's that line from A Streetcar Named Desire? We depend on the kindness of strangers. We depend on the kindness of friends. So please donate. We're doing a lot of things that require money. And with that, I'll turn it over to Bapcha. Bapcha was just reminding me that he was introduced to me by Vanessa. Vanessa is one of the people who had one of our previous sessions. She's developing an app for navigation using AI. And Bapcha, as I recall, you're in the Bay Area, right?
Yes. Yes, I'm in Santa Cruz.
In Santa Cruz. That's a nice. I grew up in Los Gatos. We've probably made that connection. So just over the hill. Yeah. And I guess it's Santa Cruz. It is just barely within what you would call sort of the Silicon Valley Bay Area, but I guess it qualifies. It's on
It does.
Anyway, with that, I'll turn it over to Bapcha, and he's going to be talking about a group that he set up, which has been looking at scams. So kind of filtering out the charlatans from where's the signal in all that noise, I guess is a way to say it. Thanks, Bapcha.
Not a problem. So let me start up my PowerPoint and then share my screen if I can. There you go. There's the PowerPoint. And hang on, I need to share my screen. Let's see, meeting view. Is my screen share? Oh, there we go. It's just turned green. Share my screen. Yeah, let's do the entire desktop or PowerPoint. Share.
Your background is in tech, if I remember, correct?
Yes. I have a new I have a new laptop, so
okay. We'll give you a break then.
Oh, thank you, thank you. You know what? Let me just share the whole thing. Come on, share. Yeah, there we go. Open system settings. Sorry about that. Yeah, hang on. Let me add some.
Oh yeah, I remember that when you get a new laptop, you have to give permission to like use the camera and all this other stuff.
Yeah, camera I did because I started the meeting kind of early, so it wants me to quit and reopen. Yeah, sorry.
Yeah, for the video recording, this is going to be, people are going to have to like get through this. One of the nice things is when I edit the transcript, I take all this stuff out.
Okay, so can you guys see my screen? Or
Yes.
All right, good. So it's a very brief primer. There's more slides than what I had planned for, but okay, a little bit of background. I was trained as a chip design engineer and I worked in the industry for about 27 years. And then I quit. I sell spices on the side for the fun of it. It's like a hobby business. And the reason I'm presenting this is because I've been adminning a cancer survivors and supporters group. The last slide has a plug for my group. For the last 16 plus years on Facebook. We have about 60,000 members and we are one of very few scientifically sound, in my mind anyway, groups. And these are some of the scams that I've come across in the last 15 years. there's a slide on how to not get taken also. So with that, let me get started. Cancer
Bob,
scams. And,
excuse me to interrupt, but just to introduce yourself, you're a lymphoma survivor, correct?
oh, yes, yes. Sorry, I didn't go over that. I had stage 3B Hodgkin's lymphoma. I relapsed once in 2007, but I've been, in remission since 2007. So yeah, so I had stage 3B the first time I was diagnosed. That was in 1995. And then it was stage 1B in the year 2007. So I've been lucky because I've been in remission for a long time.
And
So,
what inspired you to launch the community that you've launched with
so the community was launched in 2006, 2007 by a lady called Christine Tulloch and me. We were both going through treatment back then, and we wanted a group that was, scientifically sound, and we were in some ways ahead of the pack. There's 3 admins in the group, and most of our time is spent kicking out people who want to promote scams and fake science. So I will not go over too much of the fake science because this is more focused on scams. That sound reasonable, Brad?
Sounds good. Thank you.
All right, you're welcome. So yeah, I wrote this up. It's not a very pretty slide deck, but it has all the necessary ingredients, I think. Anyway, so the best of the bunch, this is some of the easiest things to sell to cancer patients are water scams and their variants. If you sell water to anybody or variants of water, you're never going to get caught, never going to go to jail. So these are the biggest scams. So among water scams, there are many. First is alkaline water and alkalized water, including baking soda, that is sold as a cure for cancer. The origin of this story comes from the 1930s. It's the Warburg effect. I will not go over that now, but that's the origin story. Holy water, we've all heard of holy water from Lourdes curing all kinds of diseases. And then electrolytes. This is interesting. So you put a current through water, and guess what happens to water? Water stays water. So there are many devices sold for electrolyzing water. The claims are absolutely unscientific. In any case, and then same thing with structurally altered too. So when you pass a current through water, the claim is that the water becomes hexagonal. Yes, if you freeze it and it becomes snow, it does become hexagonal. Some sarcasm there. And then Kangen Enagic, that's actually a business out of Japan that sell these machines that structurally alter water. They cost many thousands of dollars. Don't even look at them. Ionized, it's a variant on the same theme. Deionized, variant on the same theme. And then deuterium depleted water. This is interesting because if you actually substitute deuterium for about 66% of the human body's water, you would actually die of symptoms similar to radiation poisoning. And deuterium is naturally present in water in about 1 part in 1,000 or 1 part in 1,200, if I recall correctly. So heavy water, in other words. So any questions? So bottom line is you're selling water to cancer patients, $40 a liter, and making money. So and redox supplements. These are interesting.
Can I ask a question real quick?
Sure.
Yeah, is this the same as hydrogen water that I've been hearing a lot about?
Yes, they are all variants on the same thing. Hydrogen water, naturally, there is some hydrogen which is, in water as an ion, but it disappears very quickly, recombines with oxygen. And so, yes, it is, Inajik Kangen is one of them who claims to sell hydrogenated water. So I guess I did not include that term in the list, but yes, it's a scam. So redox supplements are interesting. Anything, even if you have sodium chloride in water, it's going to reduce, it's going to oxidize because one part of it will give up an electron, another part of it will take up another electron. There's a company called Ossia that sells a liter of 6% sodium chloride for about $50 a bottle. So, and it's a multi-level marketing scheme too. All right. So the next set of scams, I call them the most innovative because it's very devious. Most of them have commentary on stem cells. We know about stem cells. They can be powerful. They can potentially change things in our body, but these are actually stems of blueberries and grapes and any other favorite plant of yours ground up and put into a pill and sold to, cancer patients. It's a Malaysian company came up with it. They are deviously innovative. And then there's deer placenta. Yep, the cells are dead, so don't take them. Fortunately, it's orally ingested, so it won't kill anybody. You're paying a lot of money, none of the people on this group for sure, for placental cells. All right, and then the next bunch of stuff are teas, and this is actually what got me into rooting out scams in my group, because there was this SIAC, there was this Canadian nurse called Renee Case, which is SIAC spelled backwards. And she promoted a mix of about 7 herbs that you boil in water and take like a shot every day. The bottom line is it doesn't work, and I'll go into the reasons why things don't work. Then there's dandelion roots and flowers. I've actually talked to the researcher in Canada who investigated dandelion and its extracts as a cancer, medicine, if you may. So, and then soursop graviola, I'm not sure if you've heard of it. It's a complex fruit, tropical, looks pretty, actually it tastes good. I like the taste of soursop. So, and then BX protocol. This is something started by a doctor called Stanislaw Brzezinski, and he promotes a small piece, a supplement that is dissolved into water. So they're all basically teas. None of them work. And I will go into the reasons why they don't work. And then finally, diets. There's alkaline diets. We went over alkaline water in the first slide. Budwig diet. There's somebody called Dr. Budwig who invented a mostly vegan diet, macrobiotic. This is promoted by a lot of the clinics down in Mexico as a diet that will cure your cancer. And any detox anything, we're talking about coffee enemas or any detox supplements. I use detox as a code word for scam. Because, our skins, kidneys, and liver, these 3 organs do a pretty good job detoxing us of anything we may ingest. And then there's devices, Rife machines, they emit a frequency which is supposed to kill only cancer cells and leave the regular cells alone. Similar idea. And then EMF blockers. We've all heard about how bad 5G is, and a little bit of electrical engineering. Most of what our phone uses is just a variation of frequency modulation. It's just an FM radio, but at a much higher frequency, 5 gigahertz, 20 gigahertz. So, and then procedures. These are the ones that the clinics in Mexico sell. They are licensed as end-of-life care facilities. So if anyone goes to a clinic in Mexico and dies, they have no legal consequences because they are, like I shared, licensed as end-of-life care facilities. One famous person who died in one of the Mexican clinics was Steve McQueen. They do hyperbaric oxygen therapy. The bottom line is our O2 sat level cannot go beyond 100%.
Again,
Yep. And then ozone therapy. This is a little more complicated. And what they do is something like out of a dialysis machine, there's an IV that takes out your blood.
this is not good.
And then they bubble it up with oxygen and then re-inject it back into you. I've known at least 2 people who went to Mexico who ended up with a stroke because they didn't use blood thinners when injecting the blood back into your body. And IV vitamin C, we briefly touched upon that with Brad in the morning. It's mostly, expensive urine, as I call it. And then Coley's toxins. This is a concept, once again, from the 1920s, which did not work, and hence is administered to people who want to get their cancers cured in Mexico. And then stem cells, mostly dead. We touched upon that with deer placenta and ground up stems of plants in a slide prior. And oral sulfur, this is kind of new. It actually might work for some prostate cancers, but nothing has been proven yet. And then this alternative medicine. This is my take about alternative medicine. It does not work. If anything works, it can be commercialized. Premarin, it's a woman's hormone supplement. It's derived from the urine of pregnant mares. And Open Biome is a company out in Massachusetts. They do fecal implants for C. diff. So if human waste can be commercialized, pretty much anything else can be. And then homeopathy, Ayurveda, Siddha, and many more, alternative medical procedures, which are named after infamous doctors. I don't really want to go over the list right now. And then how do you protect yourself from most scams? It's actually rather easy, and I will share a link in the presentation with you. I will make sure that I email the complete presentation to Brad, or I can upload a PDF in our chat channel. First question is, ask the promoter or ask yourself, does this cure all cancers? As we know in this forum, cancer is a collection of over 300 different diseases. It can manifest in different ways. It's controlled by different mutations. There'll never, ever be one cure for all cancers. That's a very good red flag. Second one, if it's too good to be true, it probably is. And then use Carl Sagan's baloney detection kit. I really like this baloney detection kit. And if we want to, we can talk about it later after I finish up. So, and then what about misinformation, disinformation, and non-science? They are important, but they're all variations on a theme. By now, using the previous slide, you should be able to figure things out. But the pharma companies have a cure and they're hiding it. No, that's not true. Same thing with the government. And this is a new, it's not new. It's been around for some time that marijuana creates cancer. Anyone here knows when Marinol was approved? It's a synthetic form of THC, which is prescribed for anti-emesis. Anyone here knows? It was 1985. So the marijuana peddlers who claim that the FDA will not approve anything marijuana-based are wrong. And recently, Epidiolex was approved for certain seizures, which is also, it's a CBD oil version of a marijuana derivative. So, and finally, thank you for listening to me. If you have any questions, feel free to ask, or there's my phone number and there's my email address. And, but there's more actually now. And here's a plug for cancer survivors and supporters that I co-founded and I've run for about 16 years. When I first met Brad, there were 59,000 members. There's about 61,000 now, so 2,000 added over the last 3 or 4 months. You can click there to join. It goes to the Facebook site. You can hit the join button. If your Facebook account's over a year old, you're automatically let in. And that's pretty much it. And we can go back and look at any slides if you want to, or ask me questions.
Thank you, Bapcha. The way we usually do this is use the raise hand feature.
Okay,
So
sure.
we just, but Rick Davis, I'd call on first. Rick had a couple of challenges, I would say, in the chat. You might have seen them. At least some of these,
no,
he says there's evidence for a couple of these. Yeah, maybe if you could stop the screen share, we
Okay, I
can
will.
we can see everyone. Yeah. Rick, are you able to ask your question verbally that you put in the chat?
Stop share. There we go. Stopped it. Okay, I'm over. All right, let's see. Hydrogen water. Yes.
So yeah, I can mention I can raise two issues. I mean, there's certainly evidence for some of the mushroom teas, versicolor and turkey tail. Not for all cancers, but if you go to the Memorial Sloan Kettering site, there are references. What's his name at OSHA at UCSF, Abrams, Donald Abrams. I mean, there's good and solid evidence that some of the mushroom teas are and can be effective. There's also very good evidence for hyperbaric. Maybe not for everybody, but there is evidence, and we have had men with serious radiation damage to their bladder and their rectum benefit from a series of 40 hyperbaric treatments. Now, I absolutely agree with you on alternative medicine. There is no place for alternative medicine. There is a significant role for complementary medicine, and some of the treatments that you have referenced, we at ANCAM would consider to be reasonable complementary treatment that would be prescribed by centers of excellence, by the integrative medicine department at centers of excellence.
Fair enough. Noted on both the mushrooms and hyperbaric therapy. Yeah, I agree with you. The presentation that I shared was from the perspective of somebody administering a very large Facebook group that is constantly bombarded with misinformation. So, yeah, there can be one or two uses for both hyperbaric oxygen therapy and reishi mushrooms. I agree with you there. And there's other things also on the list which could be complementary, like you shared. But in general, if somebody is trying to sell you this as a cure for all cancers, it's a scam. I hope you understand the perspective that I'm coming from. I agree with you on limited uses of these therapies.
Look, I do, Bapcha, I do agree with you, but we can't go out to an educated audience like this group is.
Yes.
And make these statements. When you've got 60,000, I guess you have to have some rules. But the problem is people come to us and they say, well, Bapcha said this is a scam. And then we're faced with having to provide the research and solid research from strong accredited researchers as to why it isn't. So I think, frankly, we would agree that a lot of this is scams. I mean, I'm not sure on the waters. I've heard so much about the waters, so I don't know If any of them are good, I mean, if I come from you, they're all bad. I don't know. But the problem is it hurts your credibility and it makes it more difficult for us as advocates to sort the wheat from the chaff.
Fair enough. Let me think about it a little bit more. Like I shared with you, these are, I don't see how anything water related can help cure any kind of cancer or even alleviate symptoms of any kind of cancer. Hydrogen stays in a dissolved state in water for less than a nanosecond, and that's something that you can look up. So I can dismiss hydrogen water right off the top because it is definitely not based on science. The reishi mushrooms, yes, more testing is necessary to see where it can help patients in specific forms of cancers.
Not just Reiki. I mean, there's real good evidence for turkey tail and versicolor.
Okay.
I mean, just go to the Memorial Sloan Kettering site on herbs and what have you, and or follow the link that I put in the chat window, which will take you to all the various herbs, and they indicate what is good, what isn't good, why, side effects, etc., and just plow through that with respect to all of the substances that you're concerned about. But yeah, I mean, there is some good evidence on several different types of mushrooms.
Well, as an adjuvant, I'll agree with you, but it's the point at which some people discard their standard therapy for reishi mushroom, turkey tail tea. That's where I draw the line.
That's why I say it is complementary. It's never alternative. That's
Okay.
the difference. So
Fair enough.
we don't suggest that anybody abandons their Western medicine for any of these, their idiopathic medicine for any of these, but we do suggest that maybe some of them can make a difference in treatment
They
by
could.
adding as complementary.
I'll agree with you on that. But I am sticking to my scam line, at least for hydrogen
Okay.
water, because it cannot last for that long in its elemental state as part of water.
Okay. Obviously, there's a tension between evidence-based complementary therapies and overhyping some things as cancer cures. Alan Morris has his hand raised.
I'm
Alan,
ready for you, Alan.
Hi. I guess this question is mainly directed towards Rick concerning mushrooms. In clinical medicine, the proof is in the pudding, and one way to state that, another way, is a positive phase 3 study. I tried to hit the link that you showed, and it actually was a link to other sites, so I didn't go down trying to figure out what exactly turkey tail does. I guess my question to Rick is, are there any phase 3 studies that show turkey tail is better than some standard of care? And if not, well, actually it's a compound question, but I'll just leave that question. Are there any phase 3 positive studies for turkey tail, and for that matter, any other mushroom study?
I don't know if there are phase 3 studies. I mean, I'd have to do the research, but if I click on the link right now, it takes me to the Memorial Sloan Kettering site, Coriolis versicolor. So I'm not sure why you're not getting there. Maybe other people should try it. I can tell you that phase 3, and this is well known, that phase 3 gold standard studies for nutrition are very, very hard to run. So a discussion like this should really be had with an integrative medicine oncologist who's going to do a much better job than I can. I would be happy to provide you with whatever evidence I have. I think I have the Memorial Sloan Kettering. Donald Abrams did do a study. He is, by the way, the chief oncologist at San Francisco General, and he's also the head of OSHA at UCSF. And he has conducted studies, I remember, but I can't, I'm afraid I can't quote you chapter and verse on phase 3 studies.
Yeah, I have the Memorial Sloan Kettering Cancer Center site up, and I hit on clinical summary, and it's in reference to Coriolis versicolor. And
That's right.
The first thing it states is a cell line study. A next thing it states is a let me see.
Well, there's several. I'm looking at it. I mean, there are a load of references in there, so you can go through them. Coriolis versicolor is turkey tail, by the way.
Right.
Which you can collect. Turkey tail's easy to find where Bapcha lives.
But you have to admit, Rick, since there's no phase 3 positive studies, it's a shot in the dark based on reading cancer cell line studies and animal model studies.
No, Alan, I don't admit. Because for me, not every procedure has to be supported by a phase 3 study, because some types of treatments and drugs cannot be, because you can't do a phase 3 study. So does that mean that if you can't do a phase 3 study, we throw it out the window? Not for me. For you as a physician, maybe, but I don't do that. All I can tell you is that for us, we feel that there is sufficient evidence, and I would recommend that you read through this clinical study and follow all the. I think there are probably 10 references in there, and then make a decision.
Do you have a method to detect the negative studies? Because it's easy to find positive cell line studies and animal model studies, but it's very difficult to find negative studies because they're buried in the literature. Do you have a method for detecting negative studies?
I don't have a method for detecting anything. I'm not smart enough, Alan.
Okay.
I mean, I'm just not smart enough. When it comes to this, what I do is I talk to some of our Brains Trust. I ask them to take a look at it, and we come to a conclusion. I have certain people in my Brains Trust who are very, very much evidence-based, who don't really acknowledge any complementary medicine. I feel complementary medicine has its place. Whether it's CBD or whether it's mushrooms. Would I replace it with with Western medicine? No, I'd never replace it. Do I think it can help and make a difference? I absolutely do.
Rick, there's a concept that's bandied about that I'm sure you've heard, and I think you probably think you know what it means, but the bandied about phrase is a confirmation bias. Confirmation bias is literally the devil of every human being that walks on the planet. We all have tremendous confirmation bias because that's called the ego, and I'm referring to a psychiatric term. When you have an ego, you have built-in confirmation bias, and that you don't have a method to detect negative studies means you don't have a counterbalance to all these animal model studies and all these other studies. So I just throw that out there for you to marinate marinate in the concept of confirmation bias.
Okay, I'll cop a plea. I must have a very big ego, and I probably have a huge confirmation bias, but I have seen certain of these treatments help people over time.
Let me interrupt.
So
Let me interrupt this debate.
I
And
won't say any. I won't say any more. But what I would suggest, Alan, is you stay away. You stay well away from them.
so I want to return this back to Bapcha and the subject. I think we've hit both of these, and I also want to put a plug in. We're going to have Nasha Winters, who is an integrative oncology expert, next week. So a week from today,
Right.
who will be talking about some of those treatments that she's seeing value from. A couple of those were raised. Roger, are you able to? Roger, put them in the chat. Roger, you raised a couple that you've seen as well, just to see if Bapcha could react to, please.
Yeah, I got a couple of questions. One is on the high dose vitamin C. I've heard so many conflicting things about it. You put it up on your screen as something they offer down in Mexico.
Yes.
So does it never work? Does it sometimes work? Is it just not being applied correctly? Are you really getting sugar water down there when you think you're getting vitamin C? What's the deal on that?
Okay, this goes back to my slide on how to not get taken. If it worked, it would have been commercialized. Like I shared with you, horse pee has been commercialized. Human waste has been commercialized. Vitamin C, intravenous vitamin C, has been known for over 70, 75 years. It doesn't do anything. If it did something, somebody would have commercialized it. Much like GW Pharma went ahead and commercialized CBD oil, Epidol-X, they became instant billionaires. It was just one indication of seizures, okay? I know it's not cancer, but if it did anything to any one of 300 different kinds of cancer, it would have been commercialized already. Because I sincerely believe that the profit motive is huge. And Brad just shared, he's on lenalidomide. It's not new, it's 70 plus years old. It's a thalidomide analog. Thalidomide created those babies with no arms and legs when pregnant women took it.
Yep.
And if that can be commercialized, anything else can be. So vitamin C, the bar for commercialization is pretty darn low. And you can probably get $7 grand a month if it worked for one cancer. So if you think about it that way, it's definitely a scam.
Okay. I think it kind of has been commercialized. It cost me a lot of money when I got it. So, so if that's what commercialized means, and I don't know if it worked or not, I thought it might work and wouldn't help. But interested in your perspective. I got one other thing I'd like to just anecdotal. I'd like to get your view on something. One thing that I did, I think I completely fell for a complete fraud, was peptides. For a company that charged me a lot of money, and they're very clever how they did it. They made me go get a doctor to basically order the test, then the doctor billed me. And then they stepped out of it. And when I said, and I got the test, I got this report from them, sent it to 3 oncologists. They all said it was garbage. One of them laughed out loud. One of them said, this can't possibly do it. They say if it could, it would kill you. But this company is doing a lot. I don't want to say their name because we're recording and it's public, but they're doing a lot of business. And they've got a fancy website. And I completely fell for it because it was like you said, it was too good to be true and you want to believe. And I talked to these people kind of right after my oncologist told me I was going to die from cancer. There was no hope. So I was just swinging for the fences. And but I did learn a little bit about diligence. So after I got the report, I looked into it, and it turns out, first of all, they didn't have a real address. Their address was a vacant lot in Dallas. Their main guy, who was Dr. So-and-so, turned out to be a Dr. Divinity from some school in Chicago no one had ever heard of. And all their phone numbers went to some line in Bangladesh. So I should have known, that one's on me. It's my bad. But I guess I'm asking you in a long way, have you heard about companies offering peptides, and what do you think about them?
Not that many. I'm sure they exist. But I've not researched them, or I don't know about them. So at this point in time, and actually all ties back into Alan Morris's desire for a phase 3 trial. That's exactly what I mean by if it works, it can be commercialized. You have to go through phase 3 to commercialize it. And then, and later to commercialize something. So if something actually worked, even for one of these 300 plus different kinds of cancers, it will be commercialized. So if you look at it from that perspective, these peptides are 70 plus years old. People have known about it all this while. It's unlikely that it works. It's possible that you might come up with, and then you'll become a multi-billionaire. So anyway, that's my take.
Okay, Jeff Dwyer has his hand raised.
Sure.
You're on mute, Jeff. Jeff, you're unmuting.
I'm sorry. I'm curious, Bapcha, have you had any discussions in your larger group about transdermal estrogen use in prostate cancer? It principally the transdermal estrogen gels or patches, and because it disappeared from the pharmacies and from prescriptions in the United States, probably in the 60s, 70s, and it's used pretty extensively in other countries, England, Israel, Canada, but not in the United States. So I just wondered what you know or what you've heard about it for use for testosterone control.
I don't know much about it. So I don't think I'm educated enough to speak about that. I'm sorry. But if it's not, if the FDA doesn't allow it in the United States, then I would be concerned about it. I'm not putting 100% of my trust in the FDA, but they're pretty good. And many of these companies that sell scam products, they use the word FDA approved when it's actually FDA GRAS, generally regarded as safe. Okay, for example, the peptides that, was it Rick was talking about? Or what? Okay, yeah, that you were talking about. The peptides, it's probably safe, GRAS, in just as much of it as possible. It's not going to kill you. So, and many of these companies, they say FDA approved when they actually mean FDA GRAS. It's a terminology switch that I'm talking about. So the estrogen patches would probably be GRAS. It couldn't probably do much harm. I did not answer your question. I know I don't know much about it.
There's a complicated backstory of litigation that basically, and I just wondered if you'd run into it.
No.
I've done a lot of reading in the background on this, and I think I know the logic, but I just wanted to hear it if you stumbled into it, because it is used for testosterone control, but it's very hard to get your standard of care oncologists to buy into it because of a lot of background legal problems. So,
Okay.
but it's just, I wondered if you'd heard much about it.
No, sorry.
That's okay. Thank you.
Richard Anders, you've put a few good things in the chat. If you wouldn't mind bringing them onto the verbal record by sort of restating some of the things you were commenting on there. You're on mute.
I think this is a great discussion, and I admire Bapcha for attempting to deal with the very complicated problem of how not to get taken, because it's incredibly difficult in things that people are deeply familiar with, like your mortgage, or whether your grandchild has been arrested and needs imminent bail money to be gotten out of jail. So in something as complex as medicine, I think it's really important to, be very wary. But, just there are a lot of strands and threads here that do not make this easy. For example, I agree with Alan that, phase 3 trials are a gold standard, but, there are phase 3 drugs which don't work, and there are there are earlier stage drugs which work just fine. They haven't been through a phase 3 trial, but, a lot of the things that have gone on accelerated pathways may never have a phase 3, or only now the FDA is waking up to the necessity of a phase 3 trial on some of those. These things work even in phase 2. They, depending on the dose, they might even be working in a phase 1 trial. But no one knows that they really work because they haven't been through the quote unquote proof of a phase 3 trial. So I think that, if you are trying to figure out what to do with your own life and your risk level is reasonably high and you don't have a lot of options, you might consider going downscale in terms of proof and taking a chance on something that might have some evidence. The evidence for whether a trial works is kind of in some ways a reasonably arbitrary thing, a 0.05 p-value. What does that mean? It means that 5% of the time, the null hypothesis can be rejected. So that's a pretty good bar, but some of the time it's wrong. And some of the time it's overly restrictive as well. So there are drugs which didn't get to market, maybe because the p-value is 0.06 or 0.07, and they never got their clearance, their license. Similarly, there are, Bapcha, the example you give of drugs that don't get commercialized because if they were effective, they'd be commercialized, reminds me of the joke that I love about the economists. An economist is walking down the street with a friend, and the friend sees a $20 bill and is about to pick it up, and the economist says, "Why are you doing that? If it was a real $20 bill, it would already have been picked up." And there are plenty of things which do not get commercialized for a variety of reasons. I mean, I saw an asset a number of years ago that was basically based on trials that were well-run trials, I believe. We didn't do full diligence on it, but it was for atorvastatin to be used in macular degeneration, and there was strong evidence it could work, but it was very hard to bring to market because there was very little IP protection. And there are a lot of reasons why various drugs at various stages might be effective, but don't get to market. So, I mean, I think it's very, very hard to assess this, and I admire you for making these lists, but I think it's really important, as Rick was saying, to let people know that you have to be very wary, and the less proof there is, the warier you should be. But it does not necessarily mean that this stuff won't work.
I'm with you on that. I'm with you on
Yeah,
that.
Rick and I have been having a sidebar conversation in the chat, and again, particularly because we're having NASHA winners coming next week, I hope that some of you will join us and make the same kind of challenges on the other side, that, tell us about that evidence and what is it? Because there's, as patients, we're trying to figure this stuff out, and it's some kind of, I guess, a zone where there's some evidence that may be hyped, or there may be no evidence that's being hyped. But on the other side, there might be some signal in that noise.
Well,
right?
just to say one more thing, which is that, Bapcha, you make the point earlier on, you were talking about water, and I don't know that much about various waters, and I'm not certainly disputing what you say, but you sort of make some upfront scientific arguments on why this stuff couldn't work. And honestly, I was shocked to read after hearing the first few minutes of your talk that fully deuterated water might be dangerous. And if that is true, then your argument that, these whole water things can't work because there's not enough change to the water actually isn't entirely true. Certain effects that one might not think have any material bearing on stuff might actually have bearing. Again, it just makes the issue even harder. I think, we should.
Oh, sorry, I didn't mean to interrupt you. What I heard from you is the dose makes the poison. Yeah, feed a person pure deuterium for 2-3 months. When their body becomes 2/3 deuterium, they'll die of radiation poisoning without any radiation. So yes, it's the dose that makes the poison.
But it's not just that. Apparently, deuterium, from the brief work I was doing, does things like deuterated water can do things like raise blood pressure. And I wouldn't have thought that could have happened. I don't know what the level of radiation in deuterium is. I'd imagine it's pretty low, but
Very low.
you know, there are drug companies actually which are deuterating certain compounds in order to change the absorbance. I think Concert Pharmaceutical was doing that. So, you know, even stuff which appears scientifically, well, there's plenty of stuff that appears scientifically to have a fantastic grounding in working, doesn't work. That happens all the time. And I would say that the opposite could also be true, that just because something doesn't seem to work, you can't just dismiss it because the science seems shoddy until you know, do the experiment and know the science is shoddy.
I'd agree with you for the most part. Yeah.
Anyway, I think what you're doing is great, though.
Oh, thank you. I try.
Unless there are any other questions, I think that's a good note to end on. It's a good discussion. I think it really raises I don't know, a skepticism that's probably warranted, so that we don't become too enthusiastic. I know one of our advisors is Sumit Subudi, and he gave us that principle. Don't get too enthusiastic about things that don't have evidence and start promoting them, was a caution for us generally. So this, I think, Bapcha, you're doing us a good service to sort of, you know, have a certain humility or skepticism about things, and look for that evidence.
And I do understand that I'm, you know, so many years out from my cancer. And so I have the comfort of, you know, doing this. So I do realize that, and I'm very self-aware when it comes to that. So
Thank you.
thanks.